If you are dealing with tight hips, that shows up mostly here on the side of your hips, maybe some deep pain right at the center here, or feels like your deep hip joint itself is in pain and it radiates to your low back, do this short sequence with me because it will start to lengthen something called the external rotator, the muscles that do this to our feet. That leads to tightness in the back and in the side of your hips. And then hopefully after this short session, your feet will face straight forward again and you can move with much more ease. All right, so you'll need 2 blocks and a sticky mat so you won't slide. Good. So we'll start on hands and knees, just to get the joints moving a little bit, nothing too fancy here. All right, so shift your hips towards your heels and inhale, come forward. Do that 2 more times. Exhale, weight back. Inhale, come forward. 1 more time, weight back and come forward. Then get your right leg to the right, turn, take the top of your foot down, shift your hips to the back, and inhale, come forward. Exhale, sitting bone to heel. Inhale, shift your chest forward, and 1 more time. Come up forward. Right leg in, left leg to the sides. The back foot is like a child's pose. Top foot is down, foot is on the side. All right, from here, shift your weight back and inhale, come forward. All right, come on back in with your leg. And from here, let's get off the knees for a brief moment. Take your knees off the floor, but keep your knees bent and shift your chest towards your knees. Then straighten your right leg. Try to keep your hips still. Bend your knees. Left leg straightens. Bend your knees. Push through your arms. Straighten. And then come back down to your knees. Use your core muscles to slowly take your right leg forward. Foot parallel to the long edge of your mat. Isometrically pull the heel towards the back of the room and lift your hip up a little bit. So you can stay here. This is already a good hip stretch. Or bow forward and get your forearms onto blocks. That is a good stage. If you are more mobile, let your forearms come closer to the ground. But keep dragging your heel of your right leg backwards and your knee forwards so there is a good tone in your legs. Good. And if you can, focus on one more thing. Draw your belly button to your spine when you exhale. Come on back out, come back to all fours. Take a breath here. Take your left leg forward, move slow using your core. Parallel to the long edge of your mat, both hands on the inside. Then draw your heel and your knee to each other. So there's some strength. Good. So again, you have the options with your blocks, or you can even keep the arms straight if that is plenty, or see if maybe the forearms can make it all the way down to the ground. It's not the goal, it's just an option. Use your inhale to pull your foot and knee to each other, and the exhale to pull your belly button to your spine. Straighten your arms again, step back. Let's do another downward facing dog, but start with bent knees and shift your chest and slowly towards your knees first. Arms are strong. Then lift your hips up as high up as you can to straighten your legs. On an exhale, let your heels come closer to the floor. They don't have to touch. If they do, it's fine. If they don't, it's fine. Just don't round your low back to get there. Keep the stance wide. Allow your low back to be in a neutral position. All right, come down to your knees. Place your right foot in front of your left knee. Move your hands in front of your foot so that the arm here is in front of your shin. That's important because the knee needs to move to the right in a moment. So let's first protect this whole thing here. You draw your right heel backwards towards the back of the room and draw your left knee forward. So again, there is this tone. And then let your right knee move towards the right. So it won't touch the floor, it's just a prep. Keep dragging your right heel backwards. So this is a good stage. Maybe make your stance a little longer. Keep dragging the heel back and move your sternum closer to the inner edge of your foot. Inhale, heel back. Exhale, chest further down. Yeah, so you can move your hands here quite far apart from each other so you have a bigger base so that you maybe can also straighten your back leg here. So inhale, drag the heel back. On an exhale, feels like the base of the heart wants to move to the heel so the spine stays long, you're not rounding. And straighten your arms, lower the knee down. Place your hands closer towards your foot and release. In between, straighten the leg or legs in downward facing dog. Lower down your knees, take your left leg forward. Align your heel with your knee. Lift your toes up. Drag your left heel backwards and your right knee forward. So this is called an isometric contraction because the muscle tone is there, even though you won't see any change in shape or no movement. This will protect your joints. So that's why we have to keep doing it. Move your left knee further down. So always pay attention that you could relax your face at any stage of this progression here. So this will show you that the pose is still safe for you. You will get too tense if you're about to hurt yourself. Use the exhale to pull the belly button in and lower yourself further down. Move your right knee further back to increase the stretch. You can straighten your back leg. If the body says no, lower the knee back down. Straighten your arms, lower down the knee. Move your foot, zack, back. Yeah, with the zack, it's a German thing. And come to downward facing dog. All right, now we get to lay down on our back. Yay! So while you're laying on your back, draw your left knee towards you. Let the sole of the foot face straight up and hold on to the pinky toe side of your foot and slowly start to move the knee further down towards the ground on the side. You can keep this leg bent or you can straighten it. Again, your body will tell you. Question is always, could I smile if I wanted to? Yeah, so even if it's intense, I could still smile. That's how I know I'm not breaking anything apart, ripping any muscles apart. Good, then bend your leg again and take the ankle on top of your right knee. Use your strength to move your left knee away from you. And then the right knee towards you. Hold on to the front of your shin. Good. On an inhale, push your left knee away from you. On an exhale, move your right knee towards you. I'm using here my arm strength for that. But you got to keep pushing your left heel into your thigh, right thigh, and move the left knee away from you so there is some tone. You're not pulling on passive muscles. This will give your nervous system the key that you are aware of what you're doing and that the joint that you are stretching is safe. I mean, you're stretching the muscles, but the joint you're working on. All right, then hold on to the back of your thigh, straighten out the right leg, and then see how much you can straighten your left leg. You may have to move further away or stay closer. That depends on the length of your hammies. Keep the quads firm. And on this leg here, on the left leg, like you want to make it longer, 50 inches. Doesn't really work. My legs are still short, but the extension creates a little bit more space in the joint and tone. Good, release. Both feet down. Pull the right knee towards you, hold on to the pinky toe sides. Move the knee slightly away from you. Extend your left leg to the ground. Then pull your right knee slightly away from your rib cage and then move the knee towards the ground. And you can hear it's always directional instructions, because I don't know how far you can move. You probably also don't know how far you can move because every day is slightly different. Bend your left leg, place your right ankle on top of your left knee. Now move your right knee away from you and push the ankle into this thigh to create some tone on the outside of your right hip. Move your left knee towards you, go in between. Hold on to the front of your shin. Now again, as you inhale, the right ankle pushes into the thigh. The right knee moves away from your shoulder. With every exhalation, draw your belly button to your spine and move your left knee closer towards you. Then release the left foot down to the ground and hold on to the back of your right thigh. First, straighten out your left leg. Hold on to the back of your thigh and see how much you can straighten your leg. If it doesn't want to straighten at all, just straighten out your arms more so you have a little bit more range of motion, something to move into. So by actively extending the leg, making it straight, the quads will be firm. When the quads are firm, the hamstrings will lengthen because they feel safe. Now let's make this leg longer again. Reach with your foot up towards the ceiling, make it longer. And then you might be able to move it in a little closer with good protective muscle tone. All right. Both feet down to the floor. Just go into a bridge pose just to give the hip flexors a little bit of a length. Engage your glutes just a tiny bit for stability. Doesn't have to be a deep back bend. And then lower back down. All right. Well, we'll progress. Same thing, left leg on top of your knee. Push. Draw your right knee towards you. Left knee away from you as you inhale, right knee towards you as you exhale. Just use the strength of your legs right now. Don't help with your hands. Then you grab your foot like this with your right hand and your knee with your left hand. And then take your right knee slightly away. And see if you can rotate your leg more, trying to get your ankle closer towards your face. Extend the right leg. So this is a good one. Yeah. You could stay here, actively trying to move your ankle closer towards your face and the knee further away from you. If you want to add more, you could get your torso off the ground and also use your core muscles. Move this whole thing in closer. And you, so again, it's not a beginner class here. Wrap your elbow around your ankle. See, I'm not collapsing in my foot here. It stays flexed. So come closer here. Left arm behind you. So your head can kind of rest in your forearm. And then you can clasp your fingers. There's the microphone, so you can hear me here. Clasp your fingers here behind your head. So there we go. Sometimes my two students ask why. It's a valid question. All right, so extend your right leg. Keep moving the left knee away from you. And then here, when you now push your head into your forearm, you actually stretch your hip more. Or you could say, I have zero desire to do this. You could still be here. Make sure you can smile. And slowly release, both feet down. Okay, figure 4. Right leg up. Actively move your right knee away from you. And then take your left knee towards you. Hands are out of the equation here right now. They're not helping. So you can build the strength to protect your joints. Inhale, right knee away. Exhale, left knee towards you. Inhale. Exhale. So look at the progression. Choose one that aligns with your body's capability. Hold on to your foot. Hold on to your knee. Take the left knee slightly away. It's a good pose. Extend the leg if the body agrees. Lift your torso off the ground and move your knee in closer, and your ankle in closer, and keep moving the knee away from you. Hook your elbow around the ankle. Make sure the foot stays active. It's not sickling. It's like this, yeah, so it's like flexed. And then reach with your right arm behind you and interlace your fingers. So now make your left leg longer. Keep moving your right knee away from you and then push your head into your hand. Or it's more like the forearm, I think. And then slowly release. Don't let the leg flip out of the pose. Move slowly. Lower yourself down, straighten out the legs, firm your quads. All right, now let's do some seated poses. Just a few more and then we are done. So come to a seated position. We're going to work on the left leg first. It's similar to what we just did on the ground. If you have severe low back pain and this all of a sudden does not feel good while sitting upright, then do the same position back on your low back because it's more protected when you lay down. Yeah. I mean, severe low back pain, you probably wouldn't be here. But if it's tweaky, good. Lift your chest. You can have your right hand behind you, sit upright, and get the sole of the foot in front of you. And like we did when we were laying down, you're starting to move the knee to the space behind you. Keep lifting from your chest up. Then move your foot across. You could hold on to the foot like this. So again, there are options. Choose one that aligns with what you can do today. You could put your elbow around, a little less accessible. Or some of you may heard this one here before, the baby cradle. You lift your foot up, push the pinky toe side into the arm, wrap your arms around and then hold on like you would hold a baby, I guess. Keep lifting your chest and move your shin towards your heart. Move your heart towards the shin towards the heart. Some people do this. I don't really know what that does. I think because it's like rocking the baby. And then release. Good. Let's do this on the other side. Straighten the legs in between. Feels nice. Other side. Hold on to the pinky toe side. The shin is parallel to the floor. Left hand behind you, just fingertips, so there's some sensitivity back there. And then you lift your chest up. Move your knee to the space behind you. Try to always move up deeper on an exhale so you can also engage the core muscles to protect the low back as you start lengthening the hip muscles. They're too close, they're sharing a lot of real estate, so we're going to make sure that the core is stable before you pull on things. All right, next such variation. You can hold on to your foot like this and sit up tall. Let's see if your body agrees. So it could be the hip, but it can also be the knee. To protect the knee, you gotta keep your foot in this position. Sometimes I see this will just overstretch and weaken the ligaments on the outside of your ankle and the outside of your knee. So go further across to flex the foot all the way, sit up tall and move the knee away from you. Or like we did before, you can wrap your arm around, interlace your fingers here, pull the pinky toe side back, lift your chest, move your chin towards your heart. Inhale, move your heart towards your shin. Exhale, move your shin towards your heart. And release. Straighten out your legs. Bend your knees. You can keep your fingertips facing to the outside. Move your shoulder blades to each other. Just lift your hips up for a moment, just to lengthen the front since there is a lot of flexion happening. And then come on back down. And one more. Outer hip rotators. Left shin parallel to the short edge of your mat. Then you place your right foot here. So, your right foot on top of your left knee. If that seems impossible, it's much easier to put a block in front of your knee, and then there's a little less stress or tension on the outside of your hip muscles, and the pose all of a sudden becomes accessible. So I'll show it with a block, okay? Push the pinky toe side of your foot into the block. Action 1. Next action, drag this heel towards your hips, like you're kicking yourself into your butt. This will protect your knee. Do this on both. Then lift your chest, and with an exhalation, try to move the base of your heart towards your shin. Inhale, drag your heels back. Exhale, belly button to the spine, and heart comes closer towards your shin. Next inhale, come on all the way back up. And let's do this thing on the other side. The thing. Called fire log, or in Sanskrit, Agni Stambhasana. So right shin on the bottom. But it's not cross-legged seat. I always see this. You gotta keep the shin parallel to the short edge of your mat. You have to. So the option is to put your foot on top of your block, or if you're more mobile, put the foot on top of your thigh. Another thing I see here often is this thing. So again, if you see a lot of wrinkles because your foot is in the sickle position, you can be sure that the hip won't get much stretch, but you will have some overstretching happening on your outer knee and outer ankle. We don't want that. So get the foot across, flex your foot. Push the pinky toe side down, and then you draw your heel back. That will engage your hamstrings and the calf and protect the knee joint. So now, when you lengthen your spine, pull your belly button in and you bow forward, you're gonna feel the stretch in the fibers all the way from your low back. Ow, sometimes it hurts. And the low back, and then the outer hip muscles, the outer hip rotators. Inhale, heels back. Exhale with a long spine, belly button in, move your heart towards your shin. When you move your heart to your shin, your spine becomes long. You're not just doing this thing. And then inhale, come on back up. Straighten out both legs. You can lay back. One more time, a very simple bridge pose. It's not going to feel the sweetest because you've done so many forward folds. Lift your hips up and just be here. Tone your glutes a little bit. Keep lifting your chest and wait for a brief moment for the hip flexors to get some length. Then lower your hips down. Move your feet slightly apart from each other and let your knees fall towards each other. Close your eyes. Relax for a brief moment. Then take a deeper breath in again. Exhale. One more time, deep breath. Exhale. Roll to your side. Come on up to sitting. This should feel quite good right now after all the work you've done. Sometimes my students have the knees further down after classes like this. All right, I hope your hips will feel better, and I will see you soon.